Assalamu alaikum wa rahmatullah. My paper today will be about the prevalence of periapical lesions, root canal treatment, and restorations in a teeth adjacent to implant or to support the crowns, a multiple center cross-sectional study. This paper done by Baruwa in a University of Lisboa in Portugal, and his group. And this paper published in International Endodontic Journal in 19th of October 2021. As an introduction, the teeth adjacent to the restored or replaced ones may suffer consequences related to those treatments, as they could be at risk of developing caries or periodontal disease if the surrounding biological structures are not well maintained and preserved. The few published studies have reported inconsistent results on the status of a teeth adjacent to implants. There is a consensus that the loss of a proximal contact is an issue that may lead to deleterious effect on these teeth. These studies have documented the incidence of caries and periapical lesions on adjacent teeth using follow-up clinical records based on periapical films or digital radiographs, which display a well-known lower sensitivity when compared to other imaging modalities such as CBCT. CBCT imaging provides a three-dimensional volume with the opportunity to adjust several image visualization settings and filters, enabling a more accurate diagnosis. The objective of this present cross-sectional multi-center study was to document the prevalence of periapical lesions, root canal treatments, and crown restorations on teeth adjacent to both implant and to supported crowns on an adult population assessed by CBCT imaging. In the methodology, a total of 1,249 CBCT volumes were screened by 5 pre-calibrated observers in 11 health centers. The prevalence of periapical lesions, root canal treatment, and coronal restorations was recorded on both teeth adjacent and non-adjacent to implant or natural to supported crowns. As a result, the global sample of 22,899 teeth was included. Compared to non-adjacent teeth, the prevalence of periapical lesions, root canals treatments, and restorative procedures when adjacent to implant-supported crowns was 10.7%, 19.6%, and 22.9% higher respectively, and when adjacent to tooth-supported crowns was 19.3%, 35.6%, and 37.4% higher respectively. These results were significant only for variables root canal filling and coronal restoration. Then they conclude that the teeth adjacent to both implant and natural tooth supported crowns were associated with a higher frequency of root canal filling and coronal restorations.